Well, good afternoon, everybody, and thank you for being here today. We have a few guests joining us, and you're going to hear from them shortly. We're going to share, obviously, information about cases and hospitalizations, but we also have some information about a rental assistance program that starts today, and we're going to get to them in just a moment. As you all know, on Tuesday, we welcomed the Vice President, Admiral Burks, but also Administrator Verma and Admiral Giroir and other members of the White House Coronavirus Task Force, such as folks who were traveling with them, and Secretary DeVos was here as well. We had some productive meetings on everything from testing to opening schools to therapeutic treatments and remdesivir, convalescent plasma transfusions. We talked about the progress being made on vaccine development and so forth. And then on the previous day, we had FEMA Administrator Peter Gaynor here in Baton Rouge that we were able to meet with. And so we were able to have discussions with all of these individuals about COVID-19 and with respect to Administrator Gaynor about preparations for the remainder of hurricane season. And I will tell you, it was beneficial for us to have those discussions and to hear directly from folks like the Vice President and particularly Dr. Burks about the importance of mitigation measures to slow the spread, especially when nobody wants to go back to phase 1 or phase 0, the stay-at-home order, in order to slow the spread. Really, the only way to do that in an environment like we have in Louisiana today, with so much community spread of COVID-19 with high positivity rates on testing and so forth, is the universal or mandate, I should say, on mask usage, but also limiting crowd size and closing bars. Obviously, you all heard the Vice President say on numerous occasions that he supports those efforts, as does the President. And I think the reasons for them are all borne out by the numbers. And unfortunately, the numbers are not getting better. Today we added 2,284 new cases. That was on 22,937 tests. This week we surpassed 1 million tests, and in fact, thus far we're at 1 million, basically 24,000 tests, which is number 2 in the country in per capita testing. In the month of July, we have completed more than 295,000 tests, and for the additional tests that have been administered in the month of July, that's actually number 1 in the country. And I say that to let people know we're working really hard, because testing is critically important to know how much COVID we have, where it is, who's got it, identifying contacts and making sure these people isolate and so forth, and that we can do what we can to allow them to stay home. But we obviously are not doing everything that we would like to do, and we're going to continue to do everything we can to further surge our testing capacity in Louisiana and to reduce turnaround times on those results to make our contact tracing more effective in isolation and so forth. Since July 6th, a total of 20,577 Louisianans have visited one of the HHS surge test sites here in the Baton Rouge area. And there are 4 of those that are principal sites. We have some mobile testing that's part of that effort too, that moves around, but the 4 fixed sites are at the F.G. Clark Activity Center on Southern's campus, Alex Box on LSU's campus, Cortana Mall, and then at the Lamar Dixon facility out in Ascension Parish in Gonzales. So we've got some good news on that, that we have 60,000 tests that were made available from the federal government for that effort. Those sites were scheduled at one point to close on the 18th of July. They're going to remain open now until we use all 60,000 of those tests. And we are also going to be able to deploy beyond the Baton Rouge area, get into Acadiana and Lake Charles areas as well. More information about those specific sites will be will be coming up. But I do want to encourage everyone to take advantage of this free testing. Results come in within 2 to 3 days, and you do not have to have a symptom. You do not have to have a contact with someone who is COVID positive. Anyone can get a test just because they are worried that they may have COVID. So I'd encourage everybody to take advantage of this opportunity. You can go online to doineedacovid19test.com. doineedacovid19test.com, and then you can pre-register. Although pre-registering is not necessary either, you can just show up and be tested. Today, we are also tragically reporting 24 new deaths, bringing the number to 3,375. With respect to hospitalizations, we added 32 individuals to the hospitals since yesterday's report. We're now over 1,400 individuals who are inpatient at hospitals across the state because of COVID-19, and that is up considerably since mid-May. In fact, it's more than double since then. So we've got some work to do, obviously. The numbers bear that out. And speaking of numbers, we thought you might benefit today from hearing some data from the private sector. So Samesh Nigam, who's the Senior Vice President and Chief Data and Analytics Officer for Blue Cross Blue Shield of Louisiana, is going to come up and present some information to you all and talk about what their data is revealing. And then when he completes his presentation, I will come back up and finish up my remarks as well. Samesh?
Thank you, Governor. Thank you for inviting me to talk about this very deep partnership with Louisiana Department of Health that Blue Cross Blue Shield of Louisiana has developed. In fact, the partnership started even before the first case was announced in Louisiana. I recall seeing in our data COVID-like illness, pneumonia without flu sort of spreading all over the state. The first day when Governor and Dr. Bu announced the first case early in March, we were able to very quickly see a cluster around Lambeth House, which was the first cluster. And since then that partnership has grown. We very quickly signed an agreement. We are sending all of our data to LDH. Lee Mendoza has done a fantastic job of getting all the data from different sources that they supply to us, and we supply all of our data that we have to Louisiana Department of Health. And interestingly, we are able to fill the data gaps for each other. So for example, we have sources of data whenever hospitals and institutions want to admit somebody. So, there have been some question about quality of data, and I want to assure you that from our eyes, of course, as a payer, we pay, more than $300 million per month to healthcare services. So this data is looked at very closely, and that data that's coming to us for authorizations, for inpatient admissions, for example, or admission, discharge, and transition notices that we get daily from the healthcare system, both outpatient and inpatient. It's very closely tracking the data that LDH has published out for public for everyone to use. Very high quality data. Honestly speaking, we can't say that for some of the other states around, but we certainly can rely on the data that we have here at LDH. And indeed, we saw that initial peak that right after the first case, you already recall that peaked sometime in late March, early April, and then it started coming down. The school, we modeled the data as well, so we saw declines because of school closing and stay-at-home orders, and we were all tracking really nicely, just like New York, and everything was going in the right direction. We were very happy about it. Our NOT values that you probably have heard about were coming down, but after reopening, we of course have seen the resurgence, and that's shown in LDH data, and that's also shown in Blue Cross data. So in fact, we are back up to the number of inpatient admissions that we were seeing at the peak. And our outpatient numbers, these are people who are actually coming to the healthcare system, to outpatient clinics with symptoms, they have actually now exceeded whatever we had in the earlier peak. So clearly a situation that we need to be very aware of and do things that make all the difference. We in fact saw, curiously, when the masking guidelines came out from CDC, an immediate decline in the rates. So that's something that was very gratifying to us, that the data also showed that when you start using masks, the numbers decline. I know that's what we are trying to do again to solve for this resurgence, but my hope is that everyone will follow the universal masking, and in fact, that will help us get the disease under control. I really want to thank Alex and his team. They've done a fantastic job, and Governor, for this very data-driven approach that you have taken. Its strategy in Louisiana is driven by science. My career mostly was spent in the Northeast and New York and Philly area, but I can absolutely with pride say that Louisiana leads the country in this very strong private-public partnership and with the data we have. So from that perspective, we are ahead of the game. We need to apply the data. We need to make sure that we are doing all the right things. And I'm very confident that together we'll be able to defeat the disease. So thank you.
Thank you, Samesh. And I will tell you, Blue Cross is, if you don't know it, they have the largest market share in the private insurance market in Louisiana, but they're also one of the managed care organizations in the Medicaid program. So they have more data than any other insurance company in the state of Louisiana, and they have a very sophisticated operation. So both from a quantity and a quality perspective, the information that they have is very helpful. And I want to thank Samesh and all the folks at Blue Cross for the work you're doing, but also for providing that data to the Department of Health so that we can then just check and make sure that what we're seeing is in fact accurate. So from those numbers, you can see we still have a lot of work to do. We should start seeing any day now, I suspect, any impact to our numbers from the 4th of July weekend. And I do want to prepare people that there's no real reason to expect that over the next several days or couple of weeks, really, that we're going to see better numbers. I hope and pray that we do. But there's always a lag time between when behavior changes and when that shows up in the numbers, whether it's for good or for ill. Which brings up another point that we talked about a lot at the outset of the initial pandemic and the case growth. And that is, it's the nature of a pandemic. If you wait until the numbers show that you're imminent in terms of overrunning your capacity to deliver health care, you've waited too late. This is like a huge ship, and you've got to start turning it long before you would think is necessary in order to get it pointed in the right direction before it is too late. And that's something that we've been learning from the folks at the White House Coronavirus Task Force and a lot of other experts as well. Today is the 4th day of the new mask mandate and the other measures that we put into place. We signed the order on that on Saturday. The order became effective on Monday. Mask mandates, closure of bars, and the further limits on social gatherings. I'll tell you, the State Fire Marshal continues to educate businesses and others on their responsibilities and to respond to complaints from members of the public who are concerned about their safety when they're out and about. And I do want to spend just a moment directly addressing the Attorney General's opinion from yesterday. Let me just start by being very clear on this point. The order that I issued on Monday is in effect. It is binding. It's mandatory. Nobody should be confused by the opinion that was issued yesterday. And I will assure you that those measures that are contained in that order are necessary to protect public safety and promote the welfare of the people of Louisiana. And they are firmly based on the authority that I have in Louisiana law, based in the Constitution and statutory law as well. And I will also direct some comments to businesses across the state of Louisiana. One of the things that the legislature paid particular attention to recently was trying to make sure that civil liability was limited. In fact, there was immunity provided to businesses across the state of Louisiana with respect to employees and customers who might claim to have contracted the disease on their premises and so forth. And that immunity was granted in several bills that I signed into law. But all of that immunity is contingent upon the businesses following the guidelines of the CDC. And if you don't honor those guidelines, then you run a very real risk of not having the protections that the law affords you with respect to those liability limitations. And so I think the Attorney General's opinion was wrong on many fronts, but every front actually, but it could also cause confusion to business owners in a way that would potentially cost them a benefit of the laws that were passed just recently. And I'm asking that people comply, and I guess when it's in a mandatory order, it's more than asking. But whether you comply because you are worried about losing your immunity, or whether you do it because it's the right thing to do, and I assure you it's the right thing to do, whatever your motivation, just need people to follow the rules. Dr. Birx was very clear on Monday, publicly and privately. Given the amount of COVID in Louisiana today, how widespread it is, with, by her information, on Monday, 44 parishes having positivity factor of more than 10%. We know that 61 of the 64 parishes have high incidence rates of COVID cases of more than 100 per 100,000 over the last 14 days. That the only way to get back on top of this virus without going back to a stay-at-home order or to phase one is to have a universal mask mandate, to close bars, and to limit gathering sizes. That's precisely what we did. It was sort of fortuitous that that became effective on the day of her visit. So just want to encourage people to understand where we are. We've got a lot of work to do. Everybody has a role to play. Yesterday we launched the Frontline Worker Fund. We've already received, as of just before I walked in here, about 125,000 applications. We should surpass the 200,000, and that's the cap on how many of these $250 awards that we can actually make before we exhaust the funding that's available for it. But we should exceed that 200,000 either today or tomorrow. So I am encouraging people to apply as quickly as they can. We do know that the $250 in terms of the monetary amount isn't enough for these people who kept working and made sure that society kept functioning and that the most essential things were available to the people of Louisiana, but it is what we can afford. It's what the legislature chose to do with $50 million of CARES Act funding. So if you've not yet applied and you're an eligible frontline worker, and to find out whether you're eligible, you can get more information online as well. And we do encourage you to apply online because that's the fastest way to do it. And it is sort of a first come, first serve program. So you can go to frontlineworkers.la.gov, frontlineworkers.la.gov to apply. We do have an announcement today on rental assistance as well. The Louisiana Housing Corporation, in partnership with the State Louisiana Office of Community Development, has created the Louisiana Emergency Rental Assistance Program to provide up to $24 million in emergency rental assistance to residents facing financial hardship as a result of COVID-19. The program is available to start taking applications today. This too will be administered on a first-come, first-served basis. The initial round of funding to kickstart the program is $7 million, which is immediately available. We anticipate additional funding soon for the remainder of the additional $17 million for the total of $24 million. We know that there are thousands of Louisiana citizens who will likely need assistance in addition to the funds that we have, and so we're going to continue to look for additional funding out of CDB Community Development Block Grant allocations not yet made to Louisiana, but authorized under the previous CARES Act, but other funding opportunities that may come down, including Phase 4 of the legislation that Congress should take up at the end of this month. And hopefully there will be some funding there for rental assistance programs as well. This program is designed to help renters who've experienced financial hardship as a result of shutdowns, closures, layoffs, reduced working hours, or unpaid leave due to the pandemic. So all of those individuals are encouraged to apply. The program can also provide financial assistance to Louisiana renters who are not current on their rent and are at imminent risk of eviction due to COVID-19. Eligible renters will have payments made on their behalf to their landlords. So these payments do not go to the renters, but they'll go directly to the landlords. The payment amount depends upon income, household size, and fair market rent prices. And so what I want to do is call up Keith Cunningham of the Louisiana Housing Corporation. He's going to describe the program in more detail. We have from the Office of Community Development, Pat Forbes, here today. He will answer any questions you might have about the funding, specific funding that has been made available for this and what we're trying to get online going forward. But I'm going to ask Keith to come up now and tell you more about the program. And then on the back side of his presentation, I will come up to conclude my remarks.
Thank you, Governor. Thank you for an opportunity to come and talk about this very important program, much needed program, the Louisiana Emergency Rental Assistance Program. This program is done, as the Governor indicated, in conjunction with several partners. The main component of that is the $7 million originally available for this program. The program will be accessed through a 211 service. That 211 service that is currently in use to provide information can be used to access information regarding this program. There's also a website, LouisianaRentHelp.com, which will also be an opportunity for individuals who are in need of rental assistance to go to that website and begin the application process. Currently, the program is available to individuals who are at 30% or below average median income. And what that represents in the state of Louisiana is for a household of one, $13,000, all the way up to $25,000 for households of 4 or more. And again, this program is designed to help those individuals who are unable to pay their rent due to impacts of COVID-19, the closures, and the isolation and self-quarantine related to the COVID-19 pandemic. There are some individuals who will not be able to participate in the program, and I want to be clear. Individuals who are already receiving governmental rental assistance will not be applicable to this program. Individuals who are living in public housing will not be applicable to this program. But individuals who are experiencing difficulty and who do meet those qualifications will have an opportunity on a first-come, first-served basis to receive that benefit. That benefit will allow for 3 months of rental payment moving forward, and 3 months of back rental payment as additional emergency solution grant dollars are made available to the program. Again, this is an opportunity for us to help those individuals who need assistance paying their rent, but this is not an indication that an individual does not have to meet that obligation. If you are behind in your rent, if you do have issues with your rental payment, please make sure you contact your landlord. Please make sure you keep in contact with those individuals as you work through this process. Even as this program is offered, we don't want to indicate that there's any assurance against anyone having to pay their rent. That burden still exists. This opportunity is to help those who have that need to meet that burden. And the last thing I want to make sure that we mention about the program is that as it is on a first-come, first-served basis, we intend to allocate this money in a judicious fashion very efficiently, but we're also aware that additional dollars will be made available. And so we'll try to continue to operate this program in a way to provide the assistance that individuals need throughout the state. Governor, if there's additional questions, we'll be ready to answer. But for now, that is the gist of the entirety of the program.
Thank you. And Keith will come back in just a moment. And again, if you have questions about the details of the currently available funding or what we're looking at going forward, Pat Forbes will be here as well to answer any questions that you might have about that. Obviously, Louisiana remains at a very critical stage of our COVID-19 response. We can turn this around again. We've done it once, and in fact, the Vice President remarked the other day that of all 50 states, Louisiana is the one that had the steepest growth in cases to begin with, flattened the curve, and now in this second resurgence is dealing with this. And so he too had confidence that we in Louisiana would do what's necessary in order to flatten the curve. I believe we are going to do this again, but I know we can't do it without everybody playing the part that they have to play. I do want to let you all know that every couple of 3 weeks I have the opportunity to have a conference call with hundreds of pastors across the state of Louisiana. Last week we had such a call and received a request that I'm happy to honor today. And I know it's a little bit unusual, but I think it's something it's important, at least for me and those people on the call and many other Louisianans. So I'm going to call for 3 days of fasting and prayer for our state for July 20th through the 22nd. So that's the 20th, the 21st, the 22nd. This will be the spiritual diet and exercise that I, as a Catholic Christian, believe is very important anyway. So we'll be doing lunch fasting for those 3 days and certainly praying as well. Praying for the people of Louisiana, praying for those who are sick, praying for those who care for those who are sick, and certainly praying for the families of those who have passed on. So if you're inclined, please join me and the First Lady and faith leaders across Louisiana, regardless of your denomination or your religion. And we would ask that you join us in prayerful reflection and fasting. Again, it's lunch fasting on those 3 days. At this point in time, I'm just going to remind everyone, we know how to be good neighbors. It's time to do that in Louisiana again. And if we will do that, we're going to get through this sooner and better. And with less people becoming sick, less people entering our hospitals and taxing our healthcare delivery system, and certainly with less people dying. We'll also do it in a way that will allow us to have more of our economy open, more of our schools open, and have as much normalcy as possible before we do fully get back to normal at some point in the future. And I'm optimistic that we can do this and that we will do it. So with that, I'm going to take your questions. I do have Dr. Bu here to answer questions today as well as the individuals that have already spoken. Yes, ma'am.
What would be your message to the hundreds of bar owners across the state who are worried that their businesses are not going to survive this shutdown?
Well, first of all, I would tell them what I said on Saturday. That is not a decision that I wanted to make. It's very, very difficult, but I do think it's absolutely necessary in order to protect the public health and make sure that we do, again, get back in front of this virus, that we flatten the curve and reduce the demand on our healthcare delivery system, and ultimately we're going to save lives. Clearly, I don't relish restricting any business of any kind, and that's particularly true of shutting them down. But it is very, very clear across the world, across the country, here in Louisiana, that bars have contributed significantly to case growth, and that's borne out by the contact tracing that we've done. We have traced more outbreaks and more cases to bars than to any other setting, and that's true despite the fact that all of phase 0 and phase 1, they were closed. And it's also true that it's a best practice recommendation coming from the White House Coronavirus Task Force. On Monday's call with the nation's governors, Dr. Birx, who then came to Louisiana the next day on Tuesday of this week and repeated the same thing, included three things as being best practices right now for states like Louisiana, and those are mask mandates, bar closures, and limiting crowd sizes. And so it's not something that we want to do. Certainly, we feel for them. We really do hope that the ability to have curbside pickup, it will be something that they can take advantage of. We know that that's not going to offer them the full range of services that they're accustomed to and so forth. But at the end of the day, very difficult decisions have to be made, and this is just one of those. Yes, sir.
Governor, over the past several days, we've talked to people who have at one point in recent days been in line somewhere in Louisiana, a lot of times in this area, to get a test. And whether the lines be too long or something else, they get out of line, leave, do not test regardless, and days later receive a call that they have tested positive when they have, in fact, not done a test at all. Is LDH aware of that? How is that, maybe taken out, it was positive, fake positive, false positive, kind of what is being done to make sure the numbers are as accurate and that...
Well, first of all, that's the first I've ever heard of it. I can't answer whether LDH has heard of anything happening like this, but the good news is I have Dr. Bu here. He can come up and I assume you heard his question. Okay, Dr. Bu will come up and address it.
So thanks for the question. I'll tell you that we have heard that it's usually, I know a person whose cousin said, that's the way that we get those questions. We have not any credible reports of that. Certainly, I think what we've seen in the last week is across social media a campaign to try to erode public trust in testing in general. I think those stories are a good example of that. I think questions that are raised about whether the Department of Health is listing cases as every positive test that's run, which is not the case. If you're a case on our board, it means that you have been tested at least once as a positive. If you're tested 12 more times, we don't add you 12 more times, you're just still that one case. These kinds of stories, I think, are insidious and pernicious and quite frankly scary from a public health standpoint, because I don't think that there is a widespread effort to raise numbers. We certainly have nothing to gain from that. What there is a risk of, though, is people feeling that testing doesn't work or that they don't want to get tested, because testing is the key beginning point to understanding your risk and the community's risk for COVID, having people know that they need to isolate, take care of their health, and for people who might have been exposed to that individual, know that they also need